What this bill will do is set the table for what some people don't like to hear it characterized this way as socialized medicine. That's very uncomfortable. Oh, God bless you, that was on cue. You're acting shocked and appalled that the Healthcare Justice Act is being linked, of all shocking concepts, to socialized medicine. Well, let me tell you, that is exactly what this is all about. It is an agenda, which is why so many people are fearful. Why the business community has said, you know what, this is untenable. We can't accept it. The underlying premise is flawed. Now, the Blagojevich administration has come out, apparently the Department of Public Aid has come out, and they've given us some numbers, and I assume they've shared them with all of you. They say that if this is implemented, their conservative estimate is this would cost between $3 and $6 billion annually. Now, we can't afford it. We've got bills moments ago that are talking about recruiting people for welfare, which fortunately we rejected. You know, one of the previous speakers said that the trouble is that doctors are leaving. Well, you know what? There's a solution to the doctors leaving part of this whole equation, and that is to move several bills that are posted in the Senate Executive Committee that are probably not going to see the light of day, I'm told. But make no mistake.
Senator, hold on. Ladies and gentlemen, you're not at the theater. Please refrain from applauding or expressing congratulations, remonstrances of any type of approval or disapproval. Senator, please proceed.
Thank you, Mr. President. Make no mistake, this is a bill with an agenda. And it's not an agenda for an open market discussion about how best to meet health care needs. It's not an agenda that I think there's a Republican vote for, frankly. What we're driving towards, what we're saying is, look, let the free market intervene here. But don't tie the hands of a commission and tell them what the conclusion is that they need to come to, and then act all surprised when it's characterized in a different way. I urge a no vote.
Senator Obama?
You know, I know we're pressed for time. Normally, I don't get too exercised when we engage in these pyrotechnics, and Senator Roskam has his job to do as the spokesperson over on that side on these issues. But it's pretty rare on the floor where a bill gets this mischaracterized repeatedly. It's pretty rare where that happens. Now, a couple of statements that were just made pretty quickly that we need to go over. Number one, Senator Roskam, you are well aware of the fact that that estimate of $3 to $6 billion had to do with if there was a state health care plan that was fully funded by government, and that had nothing to do with this bill as amended. You are aware of that. You got up there and you said that that's what the department said about this bill, and you know it's not true. You also characterize this as socialized medicine or Hillary Clinton's bill, which is great politics. But there's nothing in there in this bill as amended that would indicate that. So if you want to debate Hillary Clinton's bill from 1992, that's fine. But the notion that you would blatantly characterize this bill as being that is dishonest. And I object to it. Because every time I've debated one of the bills over on that side of the aisle, I've gone to the bill. And if I had serious questions about it, I would at least read the bill and talk about what's in the bill, not what's not in the bill. You want to have a discussion about medical malpractice? I'm happy to have that discussion. And we've got a whole bunch of people on this side of the aisle who are trying to deal with the crisis that's facing doctors all across the state. That's not in this bill. What is in this bill is very simple. It says, on or before July 1st, the state of Illinois is strongly encouraged to implement a health care access plan that does the following. Provides access to a full range of preventive, acute, and long-term health services. 2, maintains and improves the quality of health care services offered to Illinois residents. 3, provides portability of coverage regardless of employment status. 4, provides core benefits for all Illinois residents. 5, encourages regional and local consumer participation. 6, contains cost containment measures. 7, provides a mechanism for reviewing and implementing multiple approaches to preventive medicine based on new technologies. And 8, affords affordable coverage options for the small business market. It does not mandate that it has to be government run. It does not preclude tax credits or a market incentive approach to providing these services. I would challenge you to find something in there that suggests anything remotely close to socialized medicine. Now, we can play politics with this thing, but let me tell you something. Last weekend, I was up talking to a bunch of Galesburg workers who've been laid off from the Maytag plant and the Butler plant. And I stood there and sat with a Butler worker who had spent 30 years putting his heart and soul into that company. And his wife had worked in the company as well. They're going to be laid off in September. Their son just had a liver transplant, and the first month's bills just on their prescription drugs is $4,500 a month. And he's trying to figure out, once he loses his job and his health insurance, how in the heck he's going to be able to provide drugs to keep his son alive. Now, if that side of the aisle thinks that that is not an issue worth studying or looking at or trying to figure out, then feel free to vote no on this bill. But the notion that somehow that all is hunky-dory and we can characterize this with a bunch of ad hominem attacks and play politics with this situation is not going to satisfy that man and his wife. And everybody here knows of same stories of members of your constituencies in your district. So if you want to vote no on this bill, vote no on it, but don't lie about it.
Senator Roskam, you've spoken once. For what purpose do you seek recognition?
Thank you, Mr. President. My name was used in debate, and just to the sponsor of the bill, my attack was not ad hominem. I was speaking to the bill. Your problem is with Senator Brady, and that's between you and Senator Brady. Now, let me address the question, since I think my characterization was unfairly characterized. The question is, who can do the things that the sponsor wants to accomplish in his own bill? Who other than the state can put together an integrated system or systems of health care delivery? Who other than the state can put together core benefits that would be provided under each type of plan? There is only one answer, and the answer is that this is a setup, setting the table, as I characterize it, for the type of government intervention in medicine that is a failure. The way that I've characterized it is dead bang on accurate, which is why it has so animated the sponsor. If I was wrong, if I was off the mark, my response would roll off his back like water off a duck as partisan flack. But the characterization that I've made is accurate, and it's dead on. And it has been rejected wholeheartedly in different jurisdictions around this country. You know what to do when the bell rings, and you know when to do it. Vote no.